Is Lyme a lifetime disease? This is Dr. Cameron. This is part of a Common Sense Lyme series. Certainly, it can feel like a lifetime, even if you're treated early. I have patients who do well with early treatment and are surprised that they remain well, and over time, they never forget how sick they were. But delayed diagnosis can increase the risk of long-term complications. Now, why is Lyme disease not diagnosed early? Some patients never develop a rash, never recall a tick bite. Others, they get a different diagnosis. Sometimes it takes a while for someone to get to a clinical diagnosis and clinical treatment. Also, treatment often stops after 21 to 30 days, and the symptoms persist. Long-term complications I've seen, and this leads to why it feels like a lifetime disease, is that there's joint inflammation. Even if the swelling goes down, you can have brain fog, encephalopathy. Cardiac complications often are more of the POTS style, and autonomic dysfunction include not just POTS, which is lightheadedness, but the stomach troubles, the sensory issues, and there can be profound fatigue. Even after treatment, these symptoms can persist. There's always a debate about the severity, but there's a consensus now that it can lead to problems with daily work, school, relationships. So some people use the word post-treatment Lyme disease syndrome. It's applied without checking for persistent tick-borne infection. I find that Babesia and Bartonella are two common co-infections that can lead to continued problems, and I find that treatment has been quite helpful. But I have colleagues who just assume it's a syndrome and just treat the symptoms. The bottom line is that it feels like a lifetime disease. Some people stay sick for months to years. I've had patients who have failed treatment. So even though it might feel like it's a lifetime, patients do quite well if they get treated and retreated, treatment for a co-infection. But also I find that supportive care like treatment of pain, fatigue, autonomic symptoms also help. And lastly, I do a lot of counseling during my visits to deal with that feeling of being chronically sick, being ill for so long, such a profound effect on their life, and I work with them to try to get over this feeling that it's a lifetime disease. It's an important disease, so we fight for everyone to get better. And thank you for joining me.